Good morning, all. Today I am going to speak about analyzing the distribution of blindness among individuals applying for visual disability certificate. Now, conflicts of interest, financial or otherwise, regarding this paper. Visual impairment is a major health problem. According to WHO, around 180 million people globally suffer from visual impairments, with about 45 million of them being completely blind. India faces a severe challenge with approximately 8.9 million blind individuals, representing nearly 20% of the global blind population. As of 2024, India could reduce the prevalence of blindness to 0.36% of the total population with the help of National Program for Control of Blindness and Visual Impairment. The main aim of my study is to analyze the major cause of vision loss, visual disability, sex preponderance, age distribution pattern, and to categorize and assess the percentage of visual disability. Materials and methods. A cross-sectional observational study was conducted in the Department of Ophthalmology, SIMS, on 100 patients seeking visual disability certificate or a period of 12 months. All subjects will undergo a detailed ophthalmic assessment, including visual acuity, strict retinoscope, anterior segment examination, A-scan biometric, keratometry, IOP, and fundus examination. And percentage of disability was calculated based on this. Patients of any age group attending ophthalmology OPD of a tertiary care center for visual disability certificates are included in our study. Patients with less than 40% disabilities are excluded from the study. Informed consent was obtained from all subjects. Statistical method, the data was collected and will be entered in Microsoft Excel. Descriptive statistics like mean percentage will be applied for quantitative data. As per the study, our results were, out of 100 individuals, majority 63% of them were males and 37% of them were females. And age distribution, majority of them falls under the category of 21 to 30 years, followed by 31 to 40 years, and then followed by 41 to 50 years. And based on the number of individuals in each category, majority of them falls under 40% of visual disabilities, followed by 60%, and then followed by 80%. And based on the causes, majority of our people who had come for visual disability certificate have congenital anomalies, followed by refractive errors and retinitis pigmentosa. And age groups is, majority of them from 1 year to 30 years of age, majority of them were having congenital anomalies, and from 31 to 40 years, majority of them having retinitis pigmentosa, and above 50 years, majority of them having diabetic retinopathy. And discussion. In our study, a male preponderance was observed, which may be attributed to the certification system being institution-based, making it difficult for females to access due to various social barriers. And this findings aligns with the studies conducted by Ghosh et al. And Joshi et al. But the 58th round survey of NSSO survey was contradicting our study. And we also found that younger patients formed a significant majority compared to older individuals, with most participants being between 21 and 30 years of age. This suggests that certification is often pursued for educational, employment, and transportation benefits, which are more likely to be relevant to younger individuals than the elderly. Ghosh et al. Reported similar findings. In our study, congenital malformations were the leading cause of visual disability, followed by refractive errors and retinitis pigmentosa, consistent with the result of studies of Karim Sab and Ghosh et al. Limitation, the exact prevalence of visual disability cannot be obtained as the registration is voluntary. The rates could not be calculated as we have no specific population denominator, and it's a hospital-based survey. Since it is not a community-based survey, it may not give the true reflection of the distribution of various causes of visual disability. And conclusion, the results indicate a high prevalence of congenital eye disease and retinitis pigmentosa, highlighting the importance of genetic counseling. With better health education, eye care, and compulsory periodic school eye screening, preventable cause of blindness can be reduced, such as refractive errors. Mandatory screening for conditions like ROP, diabetic retinopathy, and glaucoma should be implemented. Reducing eye trauma can significantly lower the risk of visual disability from corneal scarring and infection. Additionally, improving the quality of life for blind individuals require well-maintained, accessible, affordable, and sustainable rehabilitation services. These are my references. Thank you.
Thank you, Dr. ARUNIMA. Just tell me, what was the incidence of blindness in your cases regarding the glaucoma, injuries, and any other condition, apart from the retinitis pigmentosa and diabetic retinopathy?
Glaucoma, 5% of the patients.
Only? Corneal blindness kitna tha?
11, ma'am. Ma'am, those who are coming for certificate based on that only, we are taken our samples, not on the OPD basis, ma'am. Those who had come just to apply the
So
visual
in
disability
your
certificate.
center, these patients are not coming.
Glaucoma patients are not much coming, so that elderly populations, majority of them, may not be taken to hospitals by their relatives, maybe. Maybe that is why we are not
सर्टिफिकेट के लिए
getting.
मैडम वो आते हैं ना जिनको उससे फ़ायदा हो गवर्नमेंट की जॉब में उसमें तो दीज आर जनरली तो मोस्टली कंजेनिटल
इन लोग को ना प्रोफेशनल्स में टेलीफोन बूथ वगैरह भी लेते हैं बड़े लोगों को भी। ये हमारे कॉलेज में तो आते हैं।
हाँ नहीं विजुअल डिसेबिलिटी के सर्टिफिकेट लेने बहुत लोग आते हैं बट मोस्टली दोज वन हु वांट दैट 33% जो मिलता है जॉब गवर्नमेंट में फॉर द डिसेबल्ड उसका फ़ायदा उठाने के लिए कई बार हम थोड़ा सा 2 लाइन कम करके झूठा ही बना देते हैं तो टू हेल्प पीपल वी डू दैट आल्सो।
Okay, sir.
You have rehabilitation services also for these patients.
Low vision, it's like spectacle service we are providing from our centers, ma'am, no others. No, ma'am.